Hello all, this is Dr. Alsop, and we are going to discuss the muscles of the arm and the relatively more numerous muscles of the forearm. So as you can see with these learning objectives, we have quite a bit to go through. So let's go ahead and get started. So as you would imagine, we're going to start proximally and move our way distally. So we're starting with the muscles of the arm, and we're going to look at these anterior muscles. So remember, in anatomical position, these anterior muscles of the arm. And generally, the first one that kind of pops in your mind is the biceps brachii. So we think about that one when we're flexing, our muscles. And this is going to be, as its name would suggest, we're going to have two heads associated with the biceps brachii, but both of these heads are going to have attachments on the scapula. One is kind of more distinctly crossing the shoulder joint, whereas the other one is going to the coracoid process, like we talked about previously. And both of these heads are going to kind of come together to form this one muscle belly, and the distal attachment will be on that bump just below the neck of the radius, referred to as the radial tuberosity. So we have proximal attachments on the scapula and a distal attachment on the radius. And this muscle is considered a three-joint muscle, meaning that it crosses three separate joints and it can directly affect the actions of those joints. And that would be the shoulder, the elbow, or that humeral ulnar, and the proximal radio ulnar. These muscles in the anterior compartment of the arm are going to be innervated by one of the terminal branches of the brachial plexus, the musculocutaneous. So sometimes when you're getting ready to study, if you want to just make charts of the muscle compartments as a whole, so like all the anterior muscles of the arm are going to be innervated by this musculocutaneous, and that helps to kind of alleviate some of the cognitive burden that comes with this. So as we might think, the biceps brachii is going to play a role in terms of flexion of the forearm. It's actually not the most powerful one, and we'll talk about that one in a moment. It'll also play an important role in terms of supination of the forearm. And that makes sense. It's attaching on that radius. The radius is the movable bone or the moving bone during pronation and supination. So biceps brachii is going to play a role there. Now, the main flexor of the forearm is the brachialis muscle, and this is going to be deep to the biceps brachii. So we don't talk about it as much because you can't visibly see the brachialis quite as well as you can the biceps brachii. It does not extend all the way up to the shoulder joint. Its proximal attachment's here on the humerus, and its distal attachment's going to be on the coronoid process of the ulna. So it does not attach on the radius, therefore it's not going to play a role in terms of pronation or supination. And like I mentioned before, this is going to be one of the muscles of the anterior compartment of the arm. Therefore, it is innervated by musculocutaneous. Now, and those are the two major muscles. There are other muscles associated with the anterior compartment, but those are the two I want you to focus on. Now, when we're looking at the posterior compartment of the arm, there's one big muscle back there, and that is the triceps brachii. And as its name would suggest, there are three heads associated with the triceps brachii. And you can see them color-coded here. You have a long, this one will cross the shoulder joint as well, a medial, and a lateral. This medial is kind of the workhorse here. And then all of these kind of come together and they attach on the olecranon of the ulna. That's why the olecranon is so robust, because you have this really large muscle that's attaching there. And this is going to be the biggest extensor of the forearm. So if you're trying to kind of work out the triceps, you do a lot of, extending of the forearm. And this is going to be a common theme in terms of posterior compartments, and in that the triceps brachii in the posterior compartment of the arm is going to be innervated by the radial nerve. This is going to be true in terms of the posterior compartment of the forearm as well. You'll hear me say this over and over again, radial nerve equals posterior. And so this is kind of the first introduction of that. All right, moving right along to the forearm. So whereas there were bigger, more robust muscles associated with the arm, We have smaller muscles in the forearm, but way more. There are so many muscles in the forearm. And we're going to talk about some of them, certainly not all of them. And we'll talk about some common themes. And so let's start with the flexor side, which is also the anterior compartment of the forearm. Remember, anatomical position, so the anterior compartment. And recall that these were the ones that many of these have that common proximal attachment on the medial epicondyle of the humerus. So you'll have this kind of common flexor tendon where many of the more superficial muscles of the forearm are going to attach. Most of the muscles of the anterior compartment of the forearm are going to be innervated by the median nerve. So if you're trying to simplify these compartments, we have musculocutaneous, we have radial nerve. Now we're getting into this compartment being mostly median nerve. We'll talk about a few exceptions as we get to them. Now, in the superficial layer of the flexor or anterior compartment of the forearm, you're going to have some muscles, one on either side, that have a carpi and then one of the bones next to it. So flexor is telling you what it does. It flexes. Carpi is telling you where it flexes. So it's flexing the wrist region on the radial side. So flexor carpi radialis is going to play a role in terms of flexion of the wrist as well as abduction. So abduction, if you have your palm like this and you're kind of moving away from the midline. Whereas the flexor carpi ulnaris, so this is also going to flex the wrist on the ulnar side. So flexion, adduction, think about having the palm move back towards the midline. And this is one of those areas of exception. So instead of the median nerve innervation, like most of the muscles in this compartment, the flexor carpi ulnaris will be innervated by the ulnar nerve. And you can tell this if you say had median nerve damage. Obviously, that has tremendous implications in terms of this anterior compartment, but you would still be able to flex the wrist, and you'd still be able to adduct because you have a different innervation here. The intermediate division of the flexor compartment, or this anterior compartment, is a muscle called the flexor digitorum superficialis. And this is a rather wide muscle. So you can see those superficial muscles kind of sitting on top of it. And we're really starting to get into those long tendons that are going to go through that carpal tunnel. These tendons for this muscle are going to move through the carpal tunnel. And their distal attachment is going to be, and you can see this kind of outlined here, on these middle phalanges of the digits, okay? And so because it's crossing these joints, it's really going to play a big role in terms of flexing the MP, or that metacarpophalangeal, and the proximal interphalangeal joints, all right? It cannot flex the distal interphalangeal joints because its distal attachment isn't all the way onto those distal phalanges, so it's only going to flex these. It also will play a role in terms of flexion of the wrist, but its more powerful movements are here. Also of note that it's only flexing digits 2 through 5. It is not affecting the first digit. You're going to have specific muscles that are going to do that in the actual hand, and we'll talk about that in some more detail, or some of the deeper muscles of this compartment. All right, the major muscle that I want you to know in the deep compartment of the forearm is the flexor digitorum profundus. So very, very similar to the flexor digitorum superficialis, but the distal attachment of these tendons are all the way on those distal phalanges, meaning that it will be able to flex all those joints that it crosses. So the MP, the PIP, and this is the only muscle that can flex the DIP joints of 2 through 5. So again, not the first digit. And also you can really see this nicely here, that these tendons, along with the superficialis and one of the muscles that are going towards the first digit, are going through that carpal tunnel. So you have a lot of those long tendons traveling through there. Now, some of this muscle is going to be innervated by the median nerve, like most of the muscles in this compartment, but you do have some ulnar nerve innervation here as well. One other muscle, so this, we're looking at an anterior view here, palmar view anterior if you're in an anatomical position. So you see a lot of those superficial muscles that we talked about. But on the lateral side, you see this fairly big bellied muscle here referred to as the brachioradialis. And it does play a weak role in terms of flexion, but actually it's going to play a weak role of flexion of the forearm, meaning that it's going to flex the elbow. Now, to me, brachioradialis is much easier to see in the anterior compartment, but is often considered part of the posterior, and that's because it has a different innervation as it is innervated by the radial nerve. So it's a flexor that's innervated by the radial nerve, which is an odd thing because radial nerve is mostly a posterior nerve, and those posterior muscles are going to play a bigger role in terms of extension. So both of the elbow as well as the wrist and the digits. So this one's kind of the odd one out. It's generally one of the easiest muscles to be able to identify. If you look at your own kind of forearm, you should see kind of a bulge towards the side on the lateral side, and you're looking at your brachioradialis, which would be deep to that. You also have some pronator muscles associated with this anterior compartment. You have a pronator teres, which is more superior, and a pronator quadratus, which is more distal and quite deep. And as the names of these muscles would suggest, these are pronator muscles. So they are going to play a role in terms of pronation of the forearm. Now, if we want to think about it, where would these insert? They need to insert on the movable bone. And when we're talking about pronation and supination, which one is the movable bone? It's the radius. So that these are both going to have, they generally have either an attachment on the humerus with that medial epicondyle, where we're talking about the pronator teres, or on the ulna to have a distal attachment or an insertion site on the radius. All right, now let's move to the posterior compartment, also referred to as the extensor muscles of the forearm. Many of these are going to have the same kind of setup with long tendons traveling to the digits. Most of these muscles are going to have, particularly some of the more superficial muscles, are going to have an attachment, a proximal attachment on that lateral epicondyle of the humerus. What's cool about these muscles is that there are no exceptions to the rule. These are going to be the radial, they're going to all be innervated by the radial nerve. Radial nerve equals what? Radial nerve equals posterior. So radial nerve is going to innervate the posterior compartment of the arm as well as the forearm. And most of these muscles are going to play a role in terms of extension of the wrist and the digits, similar to what we had on the flexor side, but the opposite action, right? And then those those extensor carpi muscles, so we'll have a radialis longus and brevis, as well as an extensor carpi ulnaris. Those will play a role in terms of abduction and adduction. And you can see that here. I'm going to have you be able to identify the radialis longus. It's very close to the radialis brevis. So you can see the extensor carpi radialis longus and the very closely related brevis. So those carpi radialis muscles, both on the flexor and extensor side, will abduct the wrist, whereas the extensor carpi ulnaris is going to adduct the wrist, similar to that flexor carpi ulnaris. And you can see that one right here. Now, in the middle of those carpi muscles, you're going to have an extensor digitorum. So whereas on the flexor side, we had a digitorum superficialis and profundus, we only have the one on the extensor side. But they will have a similar setup in the fact that they are going to send those long tendons to the digits to play a role in terms of extension of the digits. It's kind of cool though, once they get to the digits, the tendons start to kind of flatten and create what's called expansions that kind of spread throughout. And so you have this flattened tendon that really can quite powerfully extend the digits. All right, excellent. So that was a whole lot of muscles in a fairly short amount of time. Really pay attention to what the muscle's name is telling you. Oftentimes it will just explicitly explain what that muscle does or where that muscle is located. And so sometimes anatomy names actually are helpful. Okay, I bet you were expecting this question. All right, the radial nerve, which is a terminal branch of the brachial plexus. I think at this point we've named all the terminal branches. This radial nerve is going to innervate which types of compartments in the upper limb? Is it radial nerve equals anterior, or is it radial nerve equals posterior? And hopefully you remember my chant from before, radial nerve equals posterior. So the radial nerve will be innervating the posterior compartment of the arm and the forearm. When we're talking about anterior forearm, that's mostly median nerve with a little bit of ulnar. And then anterior arm is going to be musculocutaneous. All right, excellent. We are almost to the end. We have one more video in terms of the muscles of the hand, so the intrinsic hand, and I will see you there. Thanks for your time.